Good morning, everybody, and welcome to the first vlog, really, of the NELA newsletter. So October is with us, and I just want to run you through some of the updates that we've got. So I can't possibly do that without mentioning that the Year 10 report has been published today. It's been an enormous amount of work by the project team, and I hope that you enjoy reading the updates in the report. The Year 10 data is from April 2023 to April 2024, and I'm delighted to say that in this report we see that there's the lowest ever mortality rate in any of the NELA data collection years, 8.1%, which is an amazing achievement considering that the mortality rate was 11.7 in the first report. And that equates to roughly around 1,150 less deaths annually than when NELA first began. We will be going through the report in a bit more detail in a webinar on the 15th of October that's scheduled between 12 noon and 1 p.m. The link to register for this webinar is on this slide. It's also available on the website, so do take a look at that and hopefully you can join us. It will be uploaded to the NELA channel, so you will be able to view it at a later date, but if you'd like to join us, we'd love to have you there. Patient and public involvement. We recognise at NELA that it's incredibly important to have our patients well represented within all of the aspects of work that we do at NELA. Our nursing and AHP lead, Angeline Price, has been working hard to develop a patient group for NELA that is quite broad and represents the patient population that we study in our emergency laparotomy patients. We'd like to expand this group even more, and the purpose of doing that is so that we can bring patients on to really contribute to a number of different areas. The first one of those is development of the website. We are going to be having a new website, and I'll talk a little bit more about that in a minute. And we really want patients to be engaged and involved in the development of the patient area of that website. Angeline's written a recent blog on the This community, which you can read using this link here. This community will have to log in to register to read it, but I recommend that everybody joins that community and takes a look at Angeline's blog. So can you help us in recruiting PPI patients? We'd be delighted if you could. Angeline's developed a PPI poster, which there's a link to on this slide. It's also available on our website. And you can hand this to patients who you may feel may be interested in joining our PPI group and helping NELA and each other in navigating their way through emergency laparotomy care. So I mentioned the new website. We are very aware of the difficulties that there have been with our web tool, our data collection platform, since we transitioned over to a different provider in April 2024. As a direct result of some of those difficulties, we have decided to move to a new provider. That new provider has experience with other large-scale national audits, and we're very confident that they'll be able to deliver for us a much better data collection platform with less problems. And so I'd like you to just bear with us whilst we navigate that process. We're looking to transition over probably in January 2026, and what we're hoping to deliver is a brand new NELA website, which will have a link on the website on the landing page which will take you to the new data collection platform. On the website will then be areas for clinicians, areas for patients, all of the reports from previous years and any other relevant documents. So we're really hopeful that January is going to bring some significant change to our digital platforms for the better. Keeping with the theme of digital platforms, we have decided that we are going to trial a local lead WhatsApp group. So this is something that has been used reasonably successfully by other large-scale audits in the UK. And really it's a communication platform for NELA leads across all of the subspecialties involved in emergency laparotomy care to receive direct communications from NELA, but more importantly to communicate with each other, share practice. If there's anything that you're struggling with in your organisation, you could reach out on that WhatsApp group and see if anybody has had a similar issue and has some ideas on how perhaps to resolve that. as I said, we're going to trial it for 6 months. If it's not working and it's terrible, then we will abandon ship. The idea of having another WhatsApp group fills me slightly with dread, but I do think that there is significant benefit to this sort of a platform in terms of shared learning and sharing good practice. So if a lead colleague wishes to be added to the WhatsApp group, we need you to email the NELA email address, that's nela@rcoa.ac.uk, with your name, your organisation, what your lead role is, your GMC or NMC number and contact phone number. And then one of the group admins, who are the surgical anaesthetic lead and myself, will add you to the group when we have received that information. So if you would like to be added to our new shiny WhatsApp group, do email that address with the information that we need. So that's all really. That's a quick whistle-stop tour of where we're up to in October. The Year 10 report webinar, as I said, next Wednesday, 15th of October, between 12 and 1 p.m. And do reach out to us at nela@rcoa.ac.uk with any questions, queries or feedback that you have about anything NELA related, and we can try and address that for you. Thanks very much. Bye.